Welcome to Humane Voices. I am Kelly. I am your co-host, although today I am just the host. I'm going to be flying solo because Carrie, she is not with us today, and I'm quite sure she is saving countless animals. But I am happy about today's chat. I'm really looking forward to it because it's timely. We're going to get kind of an insider's view of a recent event that all of us have heard about. As many of our listeners know, certainly Hurricane Ian, which recently made landfall at the end of September in the U.S., in Florida, received a lot of news media coverage. And when we saw the heartbreaking stories and saw the images, and it obviously left a lot of devastation in its wake. Besides just the hurricane winds, the rainfall, millions without power, it was one of the worst tropical storms in decades in Florida's history. And the communities that were devastated, obviously the people, the humans, but they have pets, and there were animals that were in dire need of support and attention. And fortunately, there were people that stepped up and said, how can I help? And we're really lucky because today, listeners, we have one of those folks with us. Really excited to introduce Dr. Katherine Polak, who is with us to talk about her efforts. She was there once the storm had passed. And she is the vice president of Humane Society International, serving as vice president of companion animals and engagement. So Dr. Polak, Doc, it is great to have you with us. Thanks for joining.
Oh, Kelly, it's great to be here. Yeah, thank you for having me.
Yeah, so I want to get in. I've got a lot of questions about this, and I know our listeners will be interested because I think we often hear about these relief efforts. And many of us, of course, will remember some of the efforts in Hurricane Katrina and just a lot of the disasters over the years. And a consistent force in those relief efforts is, of course, Humane Society of the United States, Humane Society International. But I think I want to really give some context to what takes place on the ground. I mean, we see the images of dogs and cats in their carriers and taken out of there, and it looks really, really easy. And it looks like you all just go in and make magic happen. And I know
I'm glad it looks that way.
Yeah, it completely looks effortless, but I know that is not the case. So first of all, now you're a licensed veterinarian in Florida. So were you there? Was that one of the reasons you took on this challenge?
Yeah, that's a great question, right? So the context of my work is largely international, but I happen to be a veterinarian licensed in the state of Florida, as you mentioned. And so when the disaster struck, there was suddenly this need for medical care, for veterinary care for pets that were affected, whose owners, didn't have access to their veterinarians, pets that were injured or, had chronic illness, suddenly need care. And so I received the call from our animal rescue team, recognizing that there is this sudden unmet need for veterinary care. Hey, doc, do you think you could come down and let's give this a go? And so there I was in Charlotte County, Florida.
All right. So Charlotte County was where you were at. So you were then stationed in that area, correct? No, okay, because I'm not even sure whereabouts is Charlotte County, kind of on the boot or the state. Where is
that? No, that's a great question. So Charlotte County, it's a smaller county. It has about 200,000 residents, and it's in Southwest Florida. It's about 30 minutes north of Fort Myers. And the hurricane really devastated the infrastructure of this county, specifically knocking out the power, the traffic lights, closing businesses, most of the veterinary clinics, pet boarding facilities, resources that the community needed to take care of their animals were, pretty much wiped off the map.
So when you're going, and I know this is certainly not your first rescue effort, but I would imagine you always have some expectations of what it's going to be like on the ground. So tell me, what were your expectations and what were the realities?
Well, to be honest, I really wasn't sure what to expect, to be totally honest. And I came in to this response, almost 2 weeks after the hurricane struck. So to be honest, my expectation was that, relief efforts were underway, that perhaps demand for services would be waning off. And I actually didn't think I'd be there that long, to be honest. I thought, you know what, because I knew that our animal rescue team had been on the ground, since the hurricane. They had been working with the county to evacuate shelter animals. They set up this incredibly impressive distribution center to give, the community support in terms of free pet food, pet beds, cat litter, collars, leashes, you name it, like they had it. And so I thought, well, like demand surely will be waning at this point. But little did I know once I got there that the demand, I think, for services had been unmet now for, certainly the time since the hurricane, but I think for a long time before that as well, that there was, limited access to affordable care in this community. And so when we decided to offer veterinary support, like build it and they will come, and boy, did they come.
Yeah, and did I recently read, I think it was in your guest blogging for Kitty's blog, that there were lines, of people waiting early for services.
Yeah. So what happened was when I got on the ground, I was at the distribution center. So at the Mid-Regional County Library parking lot in Charlotte County was where the Humane Society of the United States set up this distribution center. And at that time, we were having up to 600 cars come through every day for pet food and other, items that people needed to, take care of their animals when they didn't have money, to purchase it, when they didn't have access to the resources that they normally had. And as people were coming through the lot, many of them were saying, my dog's sick, my cat's injured, my rabbit hasn't been eating, like all sorts of stories. And then we thought, well, gosh, we really need to get on this. Like, how do we, establish something? Like, at that point, we didn't even know what exactly it was going to look like, but we know that we need to establish some type of veterinary care, for communities to access. And the county also requested as well. And so, we had some quick decisions that need to be made in terms of like, what does that look like? Like, where do we procure supplies from? Who's going to staff it? Because like, I'm all willing to jump right in, but we need hands. We need hands if we're talking about, feet on the ground, if we're talking about seeing, hundreds of patients. So we really had to rally at that point.
But I love the fact that, you're just set up at a library, which is great. Someone can get a little dog food, get a book.
Yeah.
But that you set up thinking, well, we're going to distribute much needed. And as you mentioned, I mean, some of these communities that you were serving already had barriers and access to,
Correct.
dog food and things. And of course, then you add on this huge natural disaster, but that you set up thinking we're going to distribute food and other items that are needed, and quickly find out, oh, okay, we almost have to set up an entire clinic for this. Now, how do you
Yes.
pivot to that? What your role is, this one thing, then it becomes much larger. How does that,
Yeah.
are you just on the phone? Are you calling in
Yeah.
favors?
All of the above, right?
Yeah.
And unfortunately, T-Mobile did not do me much service in that parking lot, so I was down the street off and on trying to get a signal. Because yes, like, how do you pivot from pet food distribution, which in and of itself is a challenge, but then when you're talking about, pivoting to veterinary care, and there's a lot of questions that need to be answered, right? Like, what scale of care? What types of medications are you going to provide? What can you distribute legally? Like, and to do that within the legal context of, practice law. And so immediately I was on the phone with our Florida State director, who was amazing, who pointed me to the Florida VMA, the Veterinary
Shout
Medical
out to Kate
Association.
McFall.
Yep, Kate McFall, she's amazing. And so then, and luckily the Florida Vet Med Association was very sympathetic. There was another team stationed in Fort Myers down the road doing similar work, but they were seeing only acute cases, emergency care, whereas I'm not sure we knew really what to anticipate. I think we also anticipated more urgent type care, but we were swamped with communities just wanting anything for their animals. Just the most basic of services, nail trims people were coming out for, like loading their dogs in the car. And so we had to quickly rally with the VMA to try to get veterinarians and technicians who were interested in helping, because they had sent out an email to all of their veterinary members saying, if you're interested in providing support, please let us know. So they had a roster of people that I think just were waiting to help. So thank God for that, right? So we had some veterinary technicians that were ready to deploy to our parking lot clinic, I like to refer to it. And we also had to figure out, okay, well, what supplies, like, where are we procuring supplies? And so luckily the Animal Rescue League of Charlotte County, has access to a lot of, vaccines and basic, dewormers, flea and tick preventive. But then we also rallied the Tampa Bay veterinary community, and they were providing as donated product. I mean, it was just incredible. Like, I would place an order, an order as in like a text message saying, hey, we really need ear meds. We really need some eye meds. And 8 a.m., incredible. There would be boxes in our parking lot of donated meds from the veterinary
Well,
community. So
and so that's amazing that there are already people ready. You know, you had the VMA, the Veterinary Medical Association,
yep.
Florida, and other, public, private entities and veterinarians ready. Of course, what they need is someone to make that ask, to place the order, do the text. But I would imagine that you had people, knowing how dedicated the profession is, from vet techs to veterinarians. You probably had people that were dealing with their own personal loss, devastation, or concerns, and yet they were signing up to, how can I help?
100%. And I think this was really touching as well. Veterinarians whose own clinics were damaged, that were coming to help or were donating product, right, that they couldn't use. But we also had veterinarians driving from Key West. I mean, that is quite a drive to help. And so it was, I mean, just incredible. And we also had some veterinarians from out of state that, that didn't necessarily have a Florida license, but said, Doc, like, sign me up. I'll be the best, animal handler you've ever seen. And it's like, come on over, because those are the people we need with great attitudes and just are really ready to get their hands dirty.
That's great. So, you had folks gathered to help. And so I think what the listeners will be interested in, and I want to hear more about this. And I know you touched on a little bit in the guest blog, some of the stories. I recall one that you shared and wrote about. There was a woman, and I'm going to get my numbers wrong, but I want to say she was in her van and she had 6 or 8 dogs and 2 cats or something that came. I mean, and
yep, if you switch the species, that's about right. Yeah,
these
if you
were
switch
free
the species,
services, right? I mean, folks,
everything for free. Yeah, everything for free. And so I think that's one of the other, just taking back a couple steps. Again, we also weren't sure how well it was going to be advertised. And then I was a bit concerned at that point that we had all these veterinarians coming, all these technicians coming, all this product that was showing up. And what if nobody shows up? Like, I also had that concern, because people say, yep, their animal's sick, but will they actually bring them out? And so the county actually sent a text message to its residents saying, free vet care in the library parking lot.
What a great problem to have. You're worried no one will show up, and then you see 600 cars.
I would show up with my own animals if I got that text message, right? And so, I mean, it was incredible. We even had Banfield, popular pet hospital, on their voicemail, and they were closed. And they said, if you need care, please visit the Charlotte County Library parking lot. So we had people just coming out in droves. And I was trying to assess, like, I was asking people online, like, how did you get here? Like, how did you hear about this? And a lot of them heard about it while they were waiting in FEMA lines for assistance. Like, it was word of mouth. It's like, hey, did you hear? You can get your animal supplies and vet care. And it was incredible. So
that's where the action
it wasn't. 100%. And I mean, speaking about the case that you were just mentioning about the woman with, many of these people that came from the county had indeed lost everything. They lost their homes. They were living in their cars. Some of them were living in their cars with their pets. Some of them were living in their front yards in tents with their pets. And so it was really heartbreaking. And so we had people with cages of cats, dogs in the car. And there were some hurricane related things that you wouldn't necessarily associate with pets, like fences blowing away. And you think about, oh, well, that's a fence. Like, what's the big deal? But the problem is now that animal can't go outside. Like many people might have medical conditions, or they can't necessarily be walking their dogs all the time, or there's debris in the yard. And so the pets are getting lacerations on their paw pads. And so we had a couple instances where dogs came in, severe bite wounds that were infected. You can smell what, this poor guy came with his terrier wrapped in a blanket, and you can smell through the blanket 10 feet away, like the infection, from these wounds. And so the dog had gotten out from a hole in the fence and got attacked by a larger breed dog. And the owner couldn't afford any care. He tried to bring it to, a public facility, and he could only afford 1 shot of, pain medication. That was it. And so he brought the dog to us, and, we were able to flush and clean the wounds and get that animal started antibiotics. And 4 cases like that were so severe that they exceeded our capacity in our parking lot clinic. Like, we offered to fund that animal's care at a practice that was open an hour or so away. And you definitely did have cases like that. Cats that had completely broken legs, chickens with broken, bones.
Okay,
it was quite extreme.
Okay, you're burying the lead there. Chickens, dogs and cats we expected. Chickens showed up.
Yeah, everything showed up, Kelly.
Oh
yeah, everything showed And, we were happy to treat it. I think that the challenge is, some veterinarians are more comfortable with other species. And so luckily we had a generally like diverse roster. And so that was a question I would ask the vets every morning because we generally had a new team every morning, which in some ways is great, but in other ways it makes it hard for, continuity of operations. But I would say, okay, like what species are you comfortable with? And anyone who could see small mammals,
Who
rabbits,
eats
we had
chickens?
squirrels come in, chickens, yeah, I mean, you name it. So it was quite heartbreaking. Some of these stories, we had people that were even just desperate for Heartgard that would come to the clinic and say, my husband's out of work, I'm out of work, and I just can't afford another month of heartworm prevention. Like, can you help me out? And we saw over the course of a week, we saw 881 patients.
Oh my God.
On the second day, we saw over 240 patients, and that's incredible with a veterinary team of like 4 or 5 veterinarians. So if you think about like what a normal caseload is at a practice, like a veterinarian sees maybe 10 cases a day on a busy day. And this was like running to car because it was so hot. We had people sit in their cars, with the air conditioning on rather than waiting on, the cement with their animals. And so we were kind of triaging as they came in, but it was incredibly busy.
So what was it? I mean, I would imagine just the sheer scope of it and not knowing what to expect. I mean, what was maybe the biggest challenge? What was the least challenging thing? I mean, I would say probably the least challenging is the services were needed. You were concerned you
Yeah,
wouldn't
I
get the
mean,
people and they came.
and the thing is too, I think one of the challenges too, and this is maybe a challenge in a different way of thinking about it, but like what do you treat? Like what is, within the realm of this clinic, right? And again, thinking we're going to see a lot of acute cases, a lot of like lacerations and cuts and fractures. But what we definitely saw our share of those, our share of skin infections, eye infections, ear infections. But a lot of these were going on far before the storm hit, right? Like some of these, rotten mouths and dental disease, like this didn't happen in the last 2 weeks, right? And the number of people that just wanted shots for their animal, like, and how important that was for them to get vaccines. And this was probably the first time that many of these animals had ever had that opportunity, ever gotten a shot. And so at that time, it was an opportunity, I think, to also kind of build that relationship and that familiarity with veterinary care to say, okay, like, do you need heartworm prevention too? Let me tell you about that. And do you need flea and tick? We're going to tell you about that too. Do you need some flea and tick shampoo to go home with? Here you go. Right. And so to really engage with each and every person that came in, I think was really special. But certainly not without challenges, right? Like power intermittent. We had a gas power generator, which was operational at times, and we used it to actually air condition a little cabin in a trailer that we could use as a cat exam room because many people were just bringing cats kind of over their shoulder through the parking lot, and you have a lot of big dogs and it's very chaotic. And so we could at least offer like a feline exam room. I mean, I'm really impressed actually, like the level of care we were able to provide. And we were joking because the product donation that we got was some really expensive product. Like if you went to a
That's great.
veterinary, clinic and got the type of care, I mean, you're talking 500-600 out the door, right? Like minimum. And so we were able to provide again free vaccination, flea and tick meds to go home, potentially heartworm medication for ears, eyes, you name it. We were able to provide it to the owner. So
And I
yeah,
love what you said about I think the education that happens at a clinic like this, that it's not just a one and done in terms of, and I don't think there's a good way to capture this, but it sounds like you could probably with confidence say there is going to be a ripple effect from this. You're going to have many families and owners that came that thought, I didn't know that, or, oh, I bet there might be a local clinic that may be a low cost clinic, or maybe I can talk to a veterinarian, or maybe I can access some services through a local shelter. Oh, I need to be doing this. Folks just didn't know. And there's
absolutely.
that impact that happens weeks after you've packed up and left.
100%. And I would say this is, I hope, the case with a lot of these really itchy dogs, right? Like, Florida is hot, it's humid, and particularly for, dogs that have allergies or what we call atopy, which is a fancy way of saying allergies. after hurricanes and when they're living in, particularly humid and with a lot of environmental allergens, they have these severe flare-ups. And so we were able to treat these dogs and then send home meds to help them feel better. And I think that is something that the owners will be very like able to discern that, like, wow, my pet is far more comfortable, like not, chewing his or herself anymore. The hot spots have resolved, and maybe I'll bring that animal for continued care. I mean, we hope. And the good news is in Charlotte County, veterinary clinics are starting to open up again. So we hope that a lot of our pop-up clinic clients do, take advantage of veterinary services as they become available again.
Yeah. So speak to a little bit in terms of the clients that would come. I mean, what were you seeing? Individuals, families, couples? I mean, what was the love?
All of the above. And I mean, we had one woman I saw every day of the clinic that was just collecting cats in our neighborhood. Yeah, she was a regular at her clinic. And as I would type her name into our spreadsheet, you could tell in Excel when you type in, right, their name pops up automatically, like you've been here before. And she was just bringing, all of her neighbors' animals, her community cats. She'd have 10 cats in the back of a van that she just wanted to get vaccinated, right? First time these animals had ever been vaccinated, right? And a lot of people, they really needed the service because, again, like they didn't have the financial means. And it really helps to try to keep pets and people together during this time, because you can imagine when you have nowhere to live and you can't, take care of yourself, it's very easy to, have to make that it's not easy, but you have to make that difficult choice of what to do with your animal. And so a lot of people were very economically disadvantaged. We did have one woman come in with her rabbit, and she reported that her rabbit hadn't been eating for 2 days. And this is really life-threatening for a rabbit. And so we, gave the rabbit fluids, and we tried to call in a special medication at Publix, the local grocery store. And she came to me, and she brought the rabbit several days for us to treat. And she came to me and she said, I really want to make a donation. She said, I didn't want free. I didn't ask for free. I just wanted somebody to treat my rabbit, right? Mm-hmm. Like I needed you guys to help, and you saved his life today, and so it was just really heartwarming, some of these stories.
And I'm going to guess, because I know it's hard work, and I imagine it's pretty round the clock, you're not sleeping, you're exhausted, and you're probably just going on, just fumes. But is it in those moments that you're like, oh, this is why we do what we do, or this is why it's got to feel good.
100%. And sometimes it's easy to, as a veterinary professional too, you're used to seeing, more advanced, medical cases. And then a lot of people would show up just for nail trims for their dogs. And you'd be like, really? Another nail trim? But when you start to talk to the people, I think, a lot of them, their groomers are closed, right? So some of these animals really did need grooming, right? Like they were becoming matted, covered in feces. They were getting infested with fleas. There was one woman who, when I was asking her about it, she's immunocompromised, and the dog now is scratching her, and she's worried about getting infected. And a lot of people are living now in very close contact with these animals, right? So this becomes also a public health concern. And so I think just having, what's the word? Like sympathy and the patience to hear people's story and why this nail trim is so important for them and their animal. Like it just shows that like you just can't ever judge a book by its cover, and we're happy to provide any service. We don't really care what it is, as long as it's within the capacity of our clinic. We're gonna try to provide it.
Well, and I like, I think the idea too that obviously you're serving such a critical need for the animals. But when you talk about the humans in this, that not only have you, helped their furry family member, but they've been seen and heard. And I think that's important. I also think that, pet owners, I think, understand this, but it's sometimes, it's probably easy for people to watch a disaster like this, such a huge event, and think, well, there's these groups, working on the animals. And I think what's key is that obviously the animals need it, as you've, laid out a variety of things. But in some of these families' worst moment in their lives, potentially, the one maybe thing or something that brings them potentially the greatest comfort, they've maybe lost everything, is their animal. And I would bet that those 600 cars, those 800 some people total, that was the case, that was their support. And I think people, it's easy to kind of forget that the human aspect really of you're saving more than animal lives.
100%. And there's so much to unpack here as I try to reflect. And I don't think I've unpacked it fully, like emotionally. But you really can touch about the continued access to care issue, right, for many people. And then you couple that with the hardships of trying to hold on to pets when you've lost literally everything else. And then also maybe an element of seeking that kind of one-on-one emotional connection and compassion via a visit to this clinic. Like there's just so much going on that really transcends, the nail trim, right?
Yeah.
It's both like heartbreaking and heartwarming at the same time.
Yeah. So tell me, and you've told me about, the woman with her rabbits, some nail trimming, the woman in the van. What is one of the stories or a family you met or a particular case that when you've had time to fully unpack all this and reflect, that'll be the takeaway. If in 2 years I come to you and say, hey, Doc, remember Hurricane Ian? What was your story? What was your moment?
Oh gosh. Well, we had so many. I think there's a couple, but one that really hit me and something that I think I didn't think about as a veterinarian are, cats are particularly sensitive to stress. Like no doubt dogs suffer and other, species suffer, but cats are just in general, like exquisitely sensitive to stress. And we had a cat that came in and maybe some of the listeners will have dealt with this themselves with feline lower urinary tract disease, like straining in the litter box, and this can become like a medical emergency really quickly. If the cat becomes blocked, like that can mean death for that animal. And so it's something that you have to take very serious as a veterinarian. And I remember, talking to this woman and trying to find out, what's going on. And as a veterinarian, the first, in clinical practice, the first question you would ask is, well, has there been any sudden changes in the household? Because that's generally why cats start to have urinary conditions, because it's out of stress. There's maybe a new baby or a new person in the house. And this woman, suddenly broke down in tears and, described her story of losing her home, and it flooded and it's completely devastated. And now she's living in a tent with her cat, and she's tried to fashion a litter box out of a cardboard box. And now she's trying to do her best to take care of herself and take care of this cat that she really loves. And it's just straining to urinate, and it's urinating blood now. And she called every clinic in the area. No one was open except for us. And so we followed up with her, right? We did what we could for the cat and provided care and fluids, and actually sent someone by the following day to check on that cat. And, luckily with some kind of stress mitigation techniques, and we sent her home with a whole lot of supplies, including a cat carrier that the cat could go in, things to try to make that cat more comfortable while it was living in this, less than ideal situation. And the woman just, really left in tears, because again, there was no one to hear her or to help her and her cat. And I think it's a testament to the fact that we've come so far in, understanding the roles that pets play in these situations, that, pets save people as much as people save pets.
Yeah, I think that's absolutely true. And I love that story, because as I'm talking to our listeners and to you, my cat is laying down here. So I can understand, the difference that made for her. And I just appreciate, of course, all that you did, our partners out there, Team Blue, the other folks involved in this work. And while, it was a just really horrific storm and so many lives were impacted, how wonderful that you got to be a part of, this amazing Herculean effort to touch animals and their owners. And that's really great. So.
Oh, absolutely. It was an incredible experience. And by the end of the week, we really had developed this system, right? Like we had our medical record keeping, we had our check-in, we had our
well-oiled
machine. We were legit.
That's great. Well, thank you so much, Dr. Polak. And for folks, please visit our website. As I mentioned, there's a blog about this, humanesociety.org. We truly appreciate your effort and for coming on and share. And I should mention to listeners, if it seemed like there were times the screen froze a little, she's a busy doc. She's actually in Chile. So we appreciate you taking this time to be with us. Listeners, as always, we appreciate you. And that is this episode of Humane Voices. We will see you next time. Thank you.